I'm sure you'll wonder, first off, who I am. I'm Ron Hutchins. I'm Chief Technology Officer for the campus here at Georgia Tech. And your first question is, why is the CTO introducing someone in healthcare? And I'll try this a little bit to explain. As CTO, I work on a number of fronts, but a lot of the things that I work on are around technology as a strategy. We are Georgia Tech, right? Georgia Institute of Technology. Technology ought to be something that we use as a strategy, not just for our back office things. In that role, one of the big areas that I've been but have been enjoying dealing with is healthcare, specifically healthcare information technology, which is a huge and growing area. One of the reasons that this is a growing area is because of the new healthcare law, which requires what's it called, useful uses of technology for healthcare, whatever the right term is. Meaningful use, thank you. And so, in part of my other job, I work with Southern Crossroads, which is a regional network, and in that front, we're doing some telecom stuff where I met the law firm of Kitchens, New and Cleghorn, which Todd is a member. Randy New, who's now a friend of ours, introduced me to Todd, and in our conversation, I was impressed by Todd's passion around healthcare and his interest in working with us on the campus and doing some of these hard things that we're doing. So I hooked up Todd and Marla. We had a good conversation, and this idea came out for us to get Todd to speak on this law. So Todd, I am excited to have you here. I'm not going to go through all of your biography here, but I will just say that Todd was Legislative Director and General Counsel for Senator Joe Lieberman during the debate and passage of the Affordable Care Act, and has firsthand experience with this. So we are in for a treat, and it's a privilege to have Todd here with us. Thank you very much.
Thank you very much, Ron, and Marla, thank you very much for setting this up. In terms of my background, I'm actually on the faculty at adjunct over the St. John's School of International Affairs. My specialty is national security. I took over as Senator Lieberman's Senator from Connecticut legislative director in January of 2009, right when President Obama was sworn into office. I didn't have any healthcare background, but obviously President Obama made healthcare his #1 domestic priority, and I being in charge of all the senator's policy issues, I had to learn really fast. And so between January of 2009 and March of 2010, when the President signed the healthcare bill into law, I spent a lot of time on healthcare policy. So it's never quite a good start to talk with disclaimers. I don't really know what I'm talking about. That's kind of what I'll let you know is that I learned this on the fly as part of the legislative process. But I got really into the weeds on the Affordable Care Act, what I think is a strong sense of its sort of political history, and I think its political history is actually going to be a determinative of its political future. And you know, everybody should read the news these days. Once the shutdown sort of got off the headlines, we've been talking about healthcare.gov and the access of folks who are uninsured who want to get health insurance, and whether or not they can actually do that through healthcare.gov, which is responsible for providing health insurance, vehicle for health insurance in 36 states today. If you watch Jon Stewart, you can see, I'm sure some people in this room might have done the last 48 hours, you'll see there are a lot of problems with healthcare.gov these days. And that has very significant long-term implications for the bill, and I kind of want to put that in context today at all. So I want to kind of start with sort of an introduction of where we are with the Affordable Care Act. The second part of the talk, I kind of want to give you a sense of why President Obama in 2009 pursued health care reform. Then I kind of want to talk a little bit about the legislative process, about how the bill was introduced, passed, considered, and kind of what we knew about the bill when it was passed. And third, I want to kind of go through the general structure of the bill. It's this big mystery to most folks, and it's a really kind of simple way to understand it when you sort of break it down, even though it's a 1,000-page bill and it spends $1 trillion. But there's kind of a very simple way to look at it. And fourth, I just kind of want to talk a little bit about what we learned about those first three parts, about what it means for the health care bill moving forward. So, I mean, the President signed the bill into law in March of 2010, and here we are in October of 2013. Many Americans still do not know what's in the bill, for good reason. It really hasn't kind of gone into effect yet. So there hasn't been this interaction, and people don't sit around reading bills in their spare time or reading congressional research or reports, so it's understandable why Americans don't know. But for folks on the far ends of the ideological spectrum, far right and far left, there's general favoritism on the left for the bill, the idea of the federal government getting involved in health insurance. And on the far right, there's general skepticism of the bill, or disfavor of the bill, because they don't see a role for the federal government in the provision of health insurance. But for the middle of America, that will eventually determine the verdict of whether or not this bill survives intact or is changed significantly, the verdict is very much out. Now, the Kaiser Family Foundation is this great organization that tracks healthcare policy in the United States, and if you're interested in healthcare policy, it's a great place to go. But they do a monthly tracking poll, and last month, in September, before the exchange went live, Their poll said that 51% of Americans still don't know what to think about the bill. And their primary question is, how does it help me? Which is very understandable. What are the benefits of this bill? Does it make health insurance more affordable, more accessible? They want to learn more about what's happening out there. And my argument to you today is how those 51% break is pretty much going to determine the future of this bill, because that 51% will determine the long-term political support. So how do we measure, and this is how we'll kind of use for today, how are we going to measure the success of this bill? Well, it improves access to health care for those who don't have it, and it perhaps lowers the costs for those who already do have it through their employer or through an existing government program. So sort of two subsets of people out there looking at this bill and measuring its success: the people who don't have health insurance today and the people who already have it. Now they will determine whether or not all these things in the bill, including insurance market reforms like no lifetime caps, no annual caps, you can't deny coverage for pre-existing condition, keeping students on their parents' coverage till they're 26, whether those things are good for them at a certain cost. Now, cost is the second half of this equation. The first part being, are the benefits good for me in my current situation? Does it make my life easier? Does it make healthcare costs go down? Does it make it more accessible? And on the back side, is it worth the cost? And when I'm saying cost to the federal government. And why is that important? Because right now we're broke. I mean, in no uncertain terms, the federal government is broke. And that's kind of what the shutdown was about. When you weren't listening to Ted Cruz, other folks were really making a compelling case for why we can't spend any more money. Why we're $17 trillion in debt right now. When President George W. and it's a bipartisan problem. When George W. Bush took office, we were $5 trillion in debt. When he left office, we were $10 trillion in debt. So it doubled. Since President Obama took office, it's gone up to $17 trillion in debt. So President Obama gets credit for more debt. President Bush gets credit for increasing it by a higher percentage. So they both get awards in this equation. So we're technically broke, because right now our debt is 73% of our GDP. In 2038, it's expected to be 100% of our GDP based on every current law staying in place. And when you get to 100% of GDP of your debt, you turn into Greece, meaning your interest rates go up, you can no longer afford to service your debt, every tax dollar you raise gets spent on servicing your debt, and you can't spend that money on infrastructure improvements, healthcare, all the things, defense, all the things that we rely on the federal government to do for us today. So, on our current path, we have to change. And if you read the Congressional Budget Office's September report, they identify 5 key drivers of our long-term debt. Not surprisingly, healthcare is right in the middle of all of that. But the first one is Social Security. We're getting older, payments are going up, we have less people working. Medicare, Medicaid is the third biggest driver of our debt. The fourth biggest driver is servicing our debt. And amazingly enough, the fifth biggest driver of our debt are the subsidies and premiums in the Affordable Care Act. That's kind of already hint of our conclusion to that. If the fifth biggest driver of our debt is the stuff in the Affordable Care Act, it kind of tells you it didn't help our debt. It's actually, one of the reasons we're actually not going in the right direction. So the verdict of the Affordable Care Act will be whether or not these benefits are worth the cost. And the fact of the matter is, the bill does cost money, a lot of money. And we'll explore that in a bit. All right, so why healthcare reform? Why did President Obama, in January of 2009, in the middle of the greatest recession since the Great Depression, decide to pursue healthcare reform? The number one issue for the American people at the time was jobs and the economy. Overwhelmingly. People just wanted the federal government to focus on the jobs, improving the unemployment rate, and just generally getting the economy going again. We were losing less amount of jobs than we ever had since World War II. And I think we were losing several 100,000 jobs a month. So that was the overwhelming compelling issue at the time. But President Obama decided in January and February of 2009 that he was going to pursue healthcare reform. Why? Because on the political left of American politics, healthcare is the number one issue. Over time, if you look at Democratic primary voters, their number one issue is healthcare. Second, it has been a long-term idea for the Democratic Party to have the federal government provide healthcare to 100% of Americans. In 1945, in November of 1945, President Harry Truman gave an address to Congress arguing for the first comprehensive healthcare plan administered by the federal government. One of his arguments, was interesting enough, was that basically we did not have enough men and women, men at the time, qualified to serve in the military because they were hurt. We needed a national health insurance program to help provide them the wherewithal to enroll in the military. But he was the first one to propose to the Democrat, obviously Harry Truman. But in 1965, President Lyndon Johnson signed into law Medicare and Medicaid. Medicare, providing government-run health insurance for people over 65. Medicaid, providing health insurance for the poor, for the less fortunate, I guess is what I should say. So that 1965 took care of old people and people less fortunate. Flash forward to 1997, President Bill Clinton signs the law, the S-chip program, to provide health insurance to kids. All right. Democrats got assisted by 2 Republicans along the way. In 1973, Richard Nixon signed into law a bill expanding Medicare to provide coverage to those with permanent disabilities. George W. Bush signed Medicare Part D, the prescription drug benefit. So if you're keeping score at home over the course of the 20th century, from Harry Truman's address in 1945 to President Obama taking office in 2009, Democrats are winning this ideological war. We have a government program to take care of old people. We have a government program to take care of the less fortunate. We have a government program to take care of kids. And we have a government program to provide prescription drugs to seniors. What's the missing element? Well, it's the 47 million people in January 2009 who don't get health insurance from their employer. 145 to 50 million people in America get health insurance from their employer today, but there was a 50 million component that was missing that global piece from the federal government. And President Obama said, I have an opportunity to finally close that ideological gap. In doing so, he also looked at his majorities in Congress, majorities that he helped win. So in the House at the time, you had 255 Democrats. You only need 218 in the House of Representatives to pass a bill. In the Senate, we had 58 Democrats in January of 2009. You need 60 to pass a bill in the U.S. Senate, so he was too short. So you can kind of get a sense of where the action was going to be, or health care was going to be in the U.S. Senate. So the reason President Obama chose health care reform as his #1 domestic issue, in addition to the economy, was partly ideological and partly also to cater to his base. And it's also very political. If you create a program that millions of people are going to rely on, those millions of people are going to vote for you in the future. Why? Because they're going to see you as the protector of that program. 1964 Civil Rights Act is a great example of that. Immigration reform might be another great example of that if President Obama can sign that bill into law, because it could lock in potentially the largest voting bloc in American politics today, the Hispanic vote. So, in terms of President Obama's decision to do that, it tells us 2 key things about the future of the Affordable Care Act. One is, he made this decision at the White House. This was not a bottom-up decision by the American people. He said, I'm going to put my political capital on the line, and I'm going to use all these folks who I just helped elect, and I'm going to push this bill through Congress. It's very much a leadership moment for him. This is where I think the agenda should be, and I'm going to put the full effort of the White House and the executive branch behind making it happen. All right? That's very important because of who owns it politically down the road. The second thing is, by pursuing healthcare reform, to the earlier point, it's ideological, which automatically, it's expanding the role of the federal government in healthcare, which automatically puts off a whole bunch of folks on the right who are saying, you know what, I will never support that idea. I'm not going to do it. There's no way I'm going to get on board. And that's also a key component to the future of the Affordable Care Act. All right, so that's why healthcare reform in January of 2009, despite the economy. Now let's go to how the bill was passed. Now the first thing that happened in 2000, in the beginning of that Congress, was actually the passage of an economic stimulus bill to meet the growing economic concern of most folks in the country. It was originally supposed to be $1 trillion bill. If the House of Representatives, if it's 255 Democrats that had this way, it would have been $1 trillion. The point of a stimulus bill was to fill the GDP gap caused by the recession. Now in the Senate, you only had 58 votes. So the White House had to compromise with Republicans. It had to go out there and find some Republican votes to get it across the finish line. And it did so. It found 3 Republicans. It found Senators Olympia Snowe from Maine, Senator Susan Collins from also from Maine, and Senator Arlene Specter from Pennsylvania. Now, interestingly, that gets you to 61. None of those senators wanted to be the 60th vote. They all wanted to be the 61st vote. So it didn't look like they were actually getting held responsible for passing the stimulus bill. But what was very interesting about that bill, it originally started off with $1 trillion, and if you read Paul Krugman in the New York Times, he would have been saying we had to do $1 trillion plus. It's the only way we'll get the economy going again. But what Senators Collins, Snowe, and Specter did is they negotiated the bill back down. They were a counterbalance, the Republican counterbalance. So it went from $1 trillion to $787 billion. Not what the president wanted, but what he could get. He signed it into law. That sort of gave you a sense, looking forward over health care, what was going to take to pass the bill. He was going to get the Democratic caucus in the Senate. He was going to get all the Democrats in the House. But at some point, he was going to have to negotiate with Republicans. If we go back to our original assessment of what's going to create success for the Affordable Care Act, it's the benefits plus the costs. The Republicans are going to be that counterbalance on the costs. So in March of 2010, early March of 2009, Peter Orszag, who was then President Obama's Office of Management and Budget Director, the numbers guy, goes to Congress to testify making the case for health care reform. And he basically makes the case that healthcare reform is about our long-term deficits. We have to get our per capita spending under control in Medicare and Medicaid and make significant changes if we're actually going to lower our deficits and our debt over time. Basically, understanding that if they were going to pass a health care bill, they were going to have to moderate that bill a little bit to get the Republican votes they needed in the U.S. Senate. But something very interesting happened in late March of 2009. Senator Specter, one of the senators who voted for the stimulus bill, switched parties. By voting for the stimulus bill and voting for TARP the previous fall, he had alienated the Republican Party, the base Republican Party in Pennsylvania where he was from. He realized the only way he was going to win re-election is as a Democrat. So he switched parties to become a Democrat. Now, if you keep score at home, Democrats go from 58 to 59 votes. Now you only need one Republican to pass the health care bill. So, flash forward a little bit. The Senate Finance Committee, which is the committee in the U.S. Senate responsible for Medicare, Medicaid, and basically healthcare policy in the United States, starts holding bipartisan hearings. So the chairman of the committee is a guy named Max Baucus from Montana. His ranking member at the time was a guy named Chuck Grassley from Iowa. And they start holding these bipartisan hearings, looking at policy options for lowering the cost of health care, improving access to care, providing more health insurance for folks. And those last in March, April, May, and into June. Well, something else happens in June. A guy named Al Franken, I'm sorry, I just always think about Saturday Night Live. Al Franken, senator from Minnesota, actually wins a contested election. All of a sudden, Democrats go from 59 votes to 60 votes. And the conversation changes significantly. So instead, so back to our original equation of this future success of the healthcare bill, benefits versus costs, that counterbalance, having Republicans on board for the cost issue, becomes an empty proposition. People start having conversations behind the scenes. Do we need Republicans to even pass this bill? Numbers-wise, we don't. However, the Democratic caucus in the Senate, maybe you got 30 or 40 liberal and moderate folks, but the numbers from 50 to 60 were pretty moderate Republicans, moderate Democrats from red states. So they had some, more interest in fiscal discipline than some of the more liberal members of the Democratic caucus. Over the summer, though, Max Baucus and Chuck Grassley and the Finance Committee insist that we're going to do this on a bipartisan basis. And they hold 31 meetings of a gang of 6. We like to talk about gangs in Congress these days. They don't quite accomplish much, but we have a lot of gangs in Congress. But they start meeting 3 Republicans and 3 Democrats in the Finance Committee, and they meet every day in Senator Baucus' conference room about exploring possible ideas for a health care bill, a bipartisan health care bill. Meanwhile, you can guess what's going on in the House, right? A partisan bill to provide as much coverage to people as possible. The public option, which had been a hardcore sort of left-wing issue at the time, certainly was going to survive in a House-passed health care bill. Not necessarily going to happen in a Senate-passed bill when you're going to be Republicans. But the conversation behind the scenes in the summer of 2009 changes significantly. The White House starts wondering, because the presidential leadership is on the line here, he was the one who put this on the agenda, are we really going to put the president's credibility in the hands of these 3 Republicans on the Senate Finance Committee to pass a bill? Are they actually serious? Do they want to pass a bill? Or are they just going to keep meeting and delay this thing to the point where it won't happen? And in Congress, there are a couple things that really matter in terms of scheduling. The first is the August recess. You want to be in a good state of mind when you go home for the August recess, because that's when you're going to meet with your constituents. And they're going to get mad at you or like you for whatever you did the first 8 or 9 months of the year. The second is the next election, okay, which is every even year. As you get closer to elections, it gets harder to do things because people back home start running their campaigns and people start paying attention. And so you kind of want to get stuff done in those first 7 or 8 months of a non-election year. So the closer the White House saw us get to the August recess, they got concerned and scared. And they basically said, we don't think these 3 Republicans, or any Republicans in the Senate for that matter, want to pass a health care bill. Not only that, why do we need it? We got 60 votes. It was a compelling argument. Senator Baucus didn't want to hear it. He was, I'm the chairman of the Finance Committee. I'm going to write the bill the way I want to write it. That's Senators Act, especially chairman of very powerful committees. Well, we break for the August recess, and Congress goes home, and there's a major uproar over quote-unquote death panels. And folks go to town hall meetings. There's some famous footage out there. But they get yelled at by constituents who are so irate about the idea of a new federal government health care run program. Don't forget, this is post-TARP, which really basically was the seed for a lot of the Tea Party activity. It's also post-George W. Bush administration that wasn't as conservative as people liked. Don't forget, George Bush might have held himself out as a conservative, but he was in the nation building in Iraq and Afghanistan. He was responsible for the biggest expansion of the federal government since Medicare and Medicare Part D. He federalized child education policy and no child left behind. People on the far right of the political spectrum felt very unrepresented. And the Affordable Care Act was sort of the last nail in that coffin of sorts. and they were going to express it, and they expressed it in those town halls in the summer, in August of 2009. And another key event happened in August of 2009, and that was the death of Senator Ted Kennedy, sort of the long-standing champion of healthcare reform on the Democratic side. And that sort of got the Democrats all saying, we're not going to let this go. We're going to do this for Ted. At the same time, they were watching these Republicans back home killing the bill. The White House realized, and even Senate leadership realized, no Republicans are going to get on board with this bill, not with Republican politics being the way that they are. So we came back in September of 2009, the talk was really serious that we're going to do a partisan-only bill. We're going to do a Democratic-only bill. So Senator Baucus goes through the motions and reports the bill out of the Senate Finance Committee and sends it to the full Senate. Over in the House, Nancy Pelosi, arguably still one of the most effective speakers in history, just considering how much legislation she got through that House, gets her bill through by November. And what the Democrats do is they then take the bill that came out of the Finance Committee and they turn it over to Harry Reid, the Senate Majority Leader. So from September to November, this bill gets parked literally in a back room in the Senate Majority Leader's office. And it gets rewritten. It gets rewritten with one purpose in mind. We are going to get all 60 members of the Democratic caucus on board with this bill. Now, if you're the whip, the guy in charge of counting votes for the Democrats, you can automatically count 45 to 50 Democrats are going to vote yes just because the president wants this bill. They're not going to take on the president of the United States of their own party. 50 through 60 gets a lot harder. Maybe up to 54, you can basically say, are you Democrat or are you not? We're going to call your donors. We're going to remind you who you are. Please keep going, and you're going to get on board. But that bill gets kind of complicated to get numbers 55 through 60 on board, especially for Democrats from red states. And what happens is as they rewrite this bill, they're thinking, you know what, all we need to do is get this bill on the floor, on the Senate floor, off the Senate floor, and into a conference. So the normal legislative process is when the House passes a bill, the Senate passes a bill, they go to a conference and they hammer out the differences. Well, if Democrats are running the conference for both the Senate and the House, they can rewrite the bill however they like. There's certain rules for a conference, but when they rules are rules until they're not rules anymore, especially in the conference. They then send the bills back to the full Senate and the full House, they pass the bill, the president signs it, it becomes law. And no Democrat was going to oppose that bill coming out of conference. So the thought was, let's just get a bill off the Senate floor, let's go to conference and make this thing work. Well, what they did in that process is they really leaned as far left as they could in drafting that bill in terms of insurance market reforms, the lifetime caps, the annual caps, the pre-existing conditions, guaranteed issue, all the things that Democrats wanted to do to the insurance markets. What they didn't have anybody in the room talking about was cost. And so as they worked on this bill, they said, all right, well, the two biggest parts of this bill that are going to cost money are the Medicaid expansion, which is expanding Medicaid to people who make 133% of poverty, and what we'll talk about in a second, the structure of the bill, the subsidies and premiums for folks who don't have insurance, who want to buy it through the health insurance exchanges. So when that bill gets finished in November of 2009, it's onto the Senate floor through procedure right on Christmas Eve. The one thing we know about that bill is it does a lot of great things for people who don't have insurance. Okay? We also know, based on scoring that came out of the Congressional Budget Office, that bill reduces the deficit by $124 billion over 10 years. How did they get there? How did they make it reduce the deficit? They needed to appeal to those moderate Democrats in the Democratic caucus. And how did they get there? Well, they just added up how much money it was going to cost in the Medicaid expansion, the subsidies and premiums, and then they raised taxes and made changes to Medicare to pay for it. So there had been, historically, all these hodgepodge of ideas to make Medicare more efficient. Nobody knew if any of these things would work, but they've been discussed by policymakers and legislators for years. They just went to the shelf, pulled those things off the shelf, had them scored by the Congressional Budget Office, and just plugged them in to pay for the cost of the subsidies and the cost of the Medicaid expansion. So the Congressional Budget Office gave us two key findings on that bill. The first question was, will this reduce the deficit? They said yes, by $124 billion. Okay. The second question was, what is it going to do to the cost of health insurance for people who have it and people who will get it? And basically, the Congressional Budget Office said, we kind of don't know. We think it's going to go up a little bit for some, down a little bit for others, but it could hold steady. It was a pretty uncertain assessment. So if we're looking at the measurement of the results with 51% that we started off our talk with today, that bill didn't provide us much certainty about what would happen. Now, something else happened after the Senate passed the bill in December of 2009. Ted Kennedy had died in August. A guy named Paul Kirk would be named his replacement. But they had to hold a special election in January in Massachusetts. What happened? Well, a Republican won. Senator Scott Brown won that seat. So if you're keeping score of the Democratic caucus, you go from 60 seats to 59 seats. And all of a sudden you're like, wow, we can go to conference. We're going to come back to conference, so we don't have cloture. We don't have 60 votes. to get that conference report finished. What are we going to do? Phil Shalero, who had been the Director of Legislative Affairs for the White House, was a longtime friend of mine, and it was his job to get this bill through Congress. And right before the State of the Union in January 2009, he and I were kind of walking past each other in the hall, and my boss, Senator Lieberman, had been kind of a problem child for health care reform, and we were probably the 58th vote that the Democrats had to get along the way. And so we had spent a lot of time in negotiations, and he wasn't too happy with me personally and professionally about that. And so all he said to me was like, don't give us any problems. We're trying to figure it out. And you could tell at the time, he wasn't quite sure how they were going to get it across the finish line. Well, they ended up talking the House into doing something called budget reconciliation, pass it, so that only needed 50 votes when it came back to the U.S. Senate. And they did that in March of 2010 and got the final bill done. So the final bill, that we talked about earlier, was basically the Senate bill. $124 billion and over 10 years deficit spending. $124 billion over 10 years is nothing. Just to put it in context from the federal budget. We're a $3 trillion annual budget. Okay? They left things out that they needed to do for healthcare reform that would have otherwise overwhelmed that $124 billion. So basically, that was the final bill that passed out of the Senate floor. So what are our two takeaways from how the bill was passed? Once again, we don't know what it's going to do for the cost of health insurance, and we don't know what's going to do to the federal deficits. So at the beginning, we kind of got a little inkling of that because CBO has told us that's one of our biggest long-term drivers of our federal debt. So that's kind of how the healthcare bill was passed. A very, very short version of it. So what does the bill look like in its final form? The way I like to look at it is sort of a three-part bill. Maybe let's do a four-part bill. Okay, the first thing the Democrats started from is how do we expand health insurance to more people? And how do we do it with better terms and conditions? All those insurance reforms we've sort of discussed and listed a few times. Well, we do it by Medicaid expansion, existing programs to 133% of poverty. And we do it through the health insurance exchanges. But the health insurance industry came to them and said, you can ask for all these great things, guaranteed issue, pre-existing conditions, lifetime caps, annual caps, but we can't do that unless you get healthy people into the system, okay? Those are great policy goals, but unless you put healthy people into the insurance pools, this thing is going to spiral out of control. It's actually called a death spiral in health insurance circles. When sick people enroll, cost of premiums keep going up, and it just basically gets out of control. So we will end up in a death spiral unless you get healthy people into the exchanges. So all right, so the second leg of the stool for the health insurance bill is the individual mandate. We're going to go out and we're going to tell people they have to buy health insurance. Okay? So the first part of those things is to expand coverage and make it better for people to buy health insurance. But the second part is the health insurance industry saying, great, you got to get people into our pools. Okay, we're going to mandate it. By the way, in the 2008 primary between Senators Clinton and Obama, Senator Clinton was in favor of the individual mandate, and then Senator Obama was not. But we had to come around to get this deal done. So the third part is, well, not everybody can afford health insurance. You can require them to buy it, but how do they pay for it? Well, that's where the premium and subsidies come into play. All right, the subsidies are done to pay for the cost of health insurance, and the premiums are done to pay for co-pays and stuff like that. I'm sorry, the subsidies are paid for co-pays that you have, and the credits are helping pay for the health insurance, and that costs a lot of money. Okay, so the fourth thing is, how do we pay for it? And those are all things I sort of talked about. They pulled off all these Medicare policy ideas in the past that in theory would save money for Medicare over time that would help offset those costs. But they also raise a significant amount of taxes. Medicare tax, the payroll tax will go up for people making over $200,000 as individuals, and over $250,000 as couples. There's also all these industry taxes put on the insurance industry, the hospital industry, the medical device industry, the pharmaceutical industry, and that kind of makes sense. They're getting all these new customers, they should share a little bit of the cost of that. That was sort of the argument behind that. But basically, the taxes were done in a way to pay for all these things, but they went in excess of the cost of all those things by $124 billion. So that is the general structure of the bill. Now, what's happened, though, since 2010, when the bill was passed on that $124 billion, we've seen that number go to zero. And what do I mean by that? Well, $89 billion of that $124 billion was in something called the Class Act, which was a long-term insurance program for people who wanted long-term care. Now, the Class Act was an idea of Senator Ted Kennedy, and it was kind of put in there with Ted Kennedy's name on it. But the Class Act was actuarially inoperable. It brought in a lot of money in the front side, but if you looked at it on 10, 15 years down the road, it was out of control. It never brought enough money to pay for the people who would need the care and the money. So the Class Act, everybody knew was actuarially off the charts. And the White House, within a year of passing the Affordable Care Act, said, you know what, we're actually not going to do the Class Act. It's not a good idea, all right? So you subtract $89 billion from that $124 billion, all right? I can't do the math in my head, but we're here at Georgia Tech, I'm sure a lot of you can. The next thing that happened was this past summer, the administration said, you know, we're going to delay the employer mandate for a year. And the employer mandate is important because if you are an employer with 50 full-time employees, you have to provide health insurance to your employees. Okay? And anybody who's a full-time employee, they've been making 30 hours, working 30 hours or more. So that put a lot of pressure on employers who were thinking about hiring that 50th employee and how many hours they should have their employees work. But the administration pushed back from employers said, you know, we're going to delay that for 1 year. Well, that was $12 billion. All right? So you add that to your 89, and I can't do the math in my head, we're getting close to $124 billion. So the other thing that's gotten a lot of traction in Congress, especially in the Senate, in a democratically controlled Senate, is the repeal of the medical device tax. Now, it's one of those industry taxes we talk about and pay the bill. Well, if you add up the medical device tax, the Class Act, and the repeal of the employer mandate, you get $124 billion exactly. That math I did before I got here. So basically, there are enough votes in the U.S. Senate today to repeal the medical device tax. You heard a lot of talk about that with the shutdown and compromise, and maybe that was a good place to arrive at a compromise because Democrats support it because it's a job killer in places like Minnesota where you have 2 Democratic senators. And it's a change to the health care bill, which Republicans want. They didn't do it, but that is a place where there is compromise and agreement in Congress these days. So basically, at this point, we're at a point where the health care bill, the medical device tax almost certainly will be repealed in time. It has no impact on the federal deficit, does not reduce it, and in fact will increase it because once you're at zero, the subsidies will continue to be along with our federal debt and our federal deficit. The other key question is, well, what does this do for the cost of health insurance for individuals who have it today and individuals who want to go out and get it? And that is the ultimate outstanding question, which I would argue will determine where that 51% breaks from the Affordable Care Act. Now, why is that? What will happen politically if they break against the bill? Well, as we talked about at the beginning a little bit, the president went out on a limb and said, I'm going to put my name on this bill. He literally has put his name on that bill. Wall Street Journal claims they were the one who gave it Obamacare. He's embraced it, so we'll call it Obamacare. All right? But he put his name on that bill, which means he had to ask members of Congress to go with him, which means their political involvement in that bill and their political investment in that bill is less, which puts a lot more pressure on the White House to sustain this over time. And that's going to isolate the president a little bit moving forward. So as people back home sit there and try to access the exchanges and figure out whether they're going to get better health insurance, and that's why what's going on right now is so critical, the political uproar will move that 51% in a direction that is not favorable to the long-term sustainability of the Affordable Care Act. And the one piece, it's an awful conclusion, but I would say to you that this is, people say it's settled law, it's hardly settled law. And if you get enough folks back home saying, you know what, I don't want these higher taxes, my health insurance rates will continue to go up, there's nothing in the bill to stop that, okay? I cannot access the exchanges if they don't make sense to me. Young people are not getting in that pool to make a risk pool better for health insurance companies. We end up in a death spiral. You will see grassroots political opposition to this bill increase. And as you get closer to the 2014 election, you're going to see Democrats running against the White House. Today, there are only 39 senators who voted for the bill who are still in the U.S. Senate. One of those senators sent a letter to the White House yesterday saying, we need to rethink this. You can already see things fray. So if you really want to watch the future of the Affordable Care Act over the next 90 days, you watch Democratic senators and you hear what they say. Right now, I guarantee you the White House is calling them saying, don't say a word, give us time, let us fix this. Give us 6 weeks, give us till Thanksgiving. Don't say a word, stay with us. But they're looking at their phone numbers back home being like, as you get closer to my election, I am not going to think about sticking with you. And once that political winds change, you could very easily see legislation that changes the Affordable Care Act moving forward. And unfortunately for people in the healthcare industry, this just means more and more uncertainty moving forward. So I was going to stop there. I have no idea how much time I took. Okay, I got a thumbs up from the back, so we're in good shape. And we'd love to open up the questions that you might have.
Just so I can think back through your story, 2009, when they still had 60 votes before Ted Kennedy. You mentioned the single payer option, is that what's called? The public option. But there were people interested in that. Why did that disappear even though they had 60 votes? Why did that come off the table? And what was the...
Just to recap what Drew, the public option was this idea that the federal government would run another health insurance company, basically, federally run, that has no profit obligations, to compete on the exchanges with the private health insurance companies. The theory being that if you had a company, if you had an entity that had no profit requirements, competing against health insurance companies that do, that competition is going to drive them to do things more efficiently and provide a better product. People who are really in favor of the public option eventually saw that public option, that public insurance company, winning and eventually becoming the sole choice. So people who eventually wanted a single payer system, i.e. the federal government being the only buyer of health care for the American people, saw the public option as a vehicle to get there. Now, opposition to the public option was ideological, the idea that we're going to expand government even more. The second was Medicare, at the time, was going broke in 2024, a federally run health insurance program. How are we going to start a new one when the one we currently have is unsustainable? And so that was also a key argument against it. And so nobody could really run the numbers on it and feel like accurate numbers on it, so it felt like it was going to cost a lot, expand the government a lot, and we had other problems already to fix. Now, you definitely had enough votes in the House of Representatives for a public option, but votes 55 through 60 in the Senate were not there to do that. And those were folks from red states, like Ben Nelson from Nebraska, Mary Landry from Louisiana, Lance Lincoln from Arkansas. And my personal involvement with the healthcare bill was my boss was actually, Senator Lieberman at the time, was the key opponent for the public option. We actually traded our vote to pull the public option out of the bill. So that was a pretty heated moment. So Majority Leader's office, probably manual, but you know, I was the one getting yelled at, so it's okay.
So I asked the right person.
Yeah, I was trying to avoid that one.
So you didn't mention the changes they're trying to make to Medicare, predominantly accountable care, which the private insurance industry is mimicking as well. Those of us on the inside, from healthcare, that's a Republican idea, by the way. Those of us on the inside think that might actually work, and there's some evidence that it is working. It's just coming out. If you don't do something about growth in Medicare costs, you're never going to get healthcare costs under control.
Right, and so if I had to say there's some really great things in the bill or promising things in the bill, I would say they are changes to Medicare. Now, I'm going to try to cover a bunch of things in this answer, but Democrats have always been the defenders of Medicare. Don't cut health care for our senior citizens. And Republicans have been like, you know what, let's find a way to kind of lower this program a little bit. That was Paul Ryan's idea. We're going to give you credits to go out into the private insurance market. That was his roadmap for America. Mitt Romney had a hard time figuring out where he felt on that. It caused some problems with Republican President McCain last year. So Democrats have always been the defender of Medicare. Republicans have been the opponents of Medicare, or just ways to kind of curtail it as a government program. What was amazing about what happened is that to pay for the subsidies and the premiums and to pay for the Medicaid expansion, Democrats said, no, we're going to cut Medicare. We're going to make changes. When I say cut Medicare, we're going to make changes to it where providers are going to be paid less, all right, where benefits are going to be less. They're being made more progressive, meaning people who make more are going to get less than people who don't make as much. We're going to raise the Medicare tax for people who make more. So there were some Democrats were really willing to kind of go in there and make changes to Medicare to pay for the health care bill. Now, what also they did is I said they went and pulled things off the shelf to see if they would work. One of the interesting stories after 9/11 is that Congress went to the FBI and said, "What new tools do you need, to stop tax items?" And so they literally pulled all these things they've been fighting for in Congress, which turned into the Patriot Act. They had their things ready on the shelf. It's the same thing with the Medicare provisions. They'd all been discussed in policy circles for years, and they went off, even in Republican circles. I mean, the individual mandate theory was a Republican idea. Heritage Foundation way back when as well. So one of the really perhaps very positive things about the Affordable Care Act are all these changes to Medicare that will create efficiencies and lower the overall cost of the program. The problem is, budget-wise, we've taken all that money and reallocated it elsewhere, as opposed to reinvesting it in the Medicare program. Another key thing about Medicare, the federal government is the largest purchaser of health care in the world, between Medicare, Medicaid, the VA, everything else in the background, okay? So when they make decisions about how to do things, it drives policy everywhere else. The private insurance markets have to adjust. And so when, by creating what's called accountable care organizations where the outcome of the patient's treatment, I don't know if I get this right, over a continuum of care from the hospital, outpatient, seeing doctors on the road, is sort of put on one umbrella so that there's one payment or there's reward for doing a better job and creating a better outcome. The idea is it'll create efficiency. Is that anything?
Well, actually, the way it works is if a group of providers contract to manage a population of Medicare patients and are able to deliver acceptable outcome measures at lower cost, Medicare gives them 60% of the savings. So it creates a financial incentive for efficiency. Actually, Medicare, as it is constructed, creates a financial incentive for inefficiency. There is no utilization review in Medicare. There is at all. If you're a Georgia Tech employee and your doctor wants to do an MRI, Blue Cross or whoever your plan's with is going to look at that and decide whether it's justified.
Right.
Medicare doesn't have that mechanism. That's its fundamental flaw.
Right. A fee-for-service program usually do pay for quality, in theory.
So let me ask you another question, and I'll shut up. So it's actually, I would bet you money, if you have a vote of all the industry insiders in the country, including the physicians, they would vote for a single payer system.
Well, how about talking about
I know a lot of people, and people inside realize this is nonsense.
Yeah.
I assume that's never going to happen in this country.
My political idea is that if it was going to happen, it was going to happen with 60 votes in the U.S. Senate and 255 votes in the House of Representatives. Democrats are not going to get that advantage again for a long time.
I don't know, after what we just saw.
Politics is a very short memory of the Affordable Care Act is a lot.
I mean, we spend about a third of all healthcare dollars on administrative expenses, most of which are due to every employer has his own insurance plans. I mean, it's ridiculous.
But the key point of our discussion is that things remain uncertain, and the Affordable Care Act did not solve those things.
Well, I understand, but they should have gone to a single payer system. They didn't.
I'm talking to different doctors. Yeah.
Can you respond to the criticism that this is designed to fail and to lead to a single payer system? Because the route that we've taken to this point almost separates it further from the single payer system. Can you respond to that criticism?
So people argue that the ACA is a way
It's designed to fail, which will then lead to a single payer system. But it seems to me they've endorsed the insurance system as it exists now by moving towards the exchanges. So they've, in effect, really separated themselves further away from the single payer system, which the government would be that payer.
Yeah, so if you think of the health insurance perspective, they did great, right? They got the federal government to say, you have to buy my product, and the federal government's going to give people money to pay for it. I mean, they walked away doing great, and they're supposed to be the big bad evil company. So we did move closer. In fact, we got even more tied to a private health insurance program. Now, people who are kind of hedging their bets, like, first of all, don't give politicians and policymakers that much credit that anybody has a really serious, long-term, like, this doesn't work. 10 years we'll be able to do that. However, that is a plan B that people are saying, well, what if the Affordable Care Act doesn't work? What if insurance rates do continue? We have no guarantee that they're going to go down. We have no guarantee that the 51% we talked about are going to be happy. What is the next plan? Well, our next plan would be, we tried it the private way. It didn't work. There's only one option. It's a single payer system. So they would use the failure, and any good politician uses any success or failure to an advantage about why, if you listen to me, it would have been a lot better. Or that was my idea in the first place. It just depends on what the outcome is.
Actually, believe it or not, a single payer system and private insurance are not mutually incompatible. In Switzerland, because every other country on earth has a single payer system. I'm sure you know, we're the only industrial country that does it. In Switzerland, the private insurance companies bid to be the payer in each of the cantons. You can do that in the States very easily. They just use competitive market pressures. But instead of having 50,000 different plans, you have one plan, one set of rules. The whole payment system, the process, everything is just enormously simplified. I say this as someone who ran a company that had the right medical billing systems. You can't imagine the complexity.
Yeah, but I also think if you're going to talk about doctors in this country, and the AMA is a lobby. I know they represent all doctors. I know they represent all doctors.
They don't come close anymore.
Right, but they do seem to have the voice.
The AAFP, which is the biggest medical organization, is in favor of single payer.
Is that if you're, at the end of the day, this is about dollars. And people vote on their dollars. And if your payer mix, I wasn't getting into payer mix, but my sense is, from the doctor I talk to, the political process in the hospitals, if you're going to reduce the payer mix, where it's going to look a lot more like Medicaid, or even like Medicare, they're going to be unhappy. But if you're going to produce a single payer system that's going to keep rates reimbursing near or at a private health insurance market, it's something to be more amenable to. But I think, to me, that's a very difficult case to make. But we can disagree.
I mean, if you could get the administrative costs out of the system, you could keep the rest pretty much as it is, you'd be all right for a long time.
You got a few more years of experience. Not anything else. I'm going to need that. Yeah.
What are some of the changes that you anticipate or can theorize may be considered in this next round?
I think they have to figure out a way to do the bread and butter stuff and lower costs. I can see backing away from certain premiums and credits until to lower the overall cost. I can see because that's where the political pressure is going to be. Because we can't afford this, and they're going to be moderate Democrats who are going to kind of support that idea. I do see all the Medicare changes more or less staying in place because they're already there and they're already changing the private health insurance market. But it is possible that if you pull out the employer, this is the ultimate scenario, you pull out the individual mandate. This is why the next 6 weeks are so important. So let's focus on this and what will spark change and how drastic that change will be. So right now, people who are healthy need to get on these exchanges and buy health care. Otherwise, for next year, they get hit with a penalty. And that penalty raises revenue to help pay for the bill. That penalty is either $95 or 1% of your taxable income in 2014. You can't ask people to pay a penalty if they can't sign up for insurance. And the closer, that's where the ball game is for the next 8 weeks. And that's why the White House wants time to get this thing fixed. If you have to back off the individual mandate, then all those insurance market reforms start around. The cost of insurance goes up, the cost of premiums and subsidies goes up, and that's when things start around. And that'll create the political pressure to change. They can hold, it's almost like a last line of defense. The White House can hold this for now, get people enrolled, get those numbers up, get healthy people enrolled, they can keep the system almost intact. But once you require that first legislative fix, now the president delayed the employer mandate by executive action, okay? The law says the employer mandate is going to affect 2014. He said, you know what, I'm not going to do that. He's supposed to execute the laws. I mean, why did he do that? Because he didn't want to go back to Congress for a change. Because the moment that this Republican House has a chance to legislate in the Affordable Care Act that he'll sign, all bets are off. And so that's kind of what my answer to your question is. The moment he needs a legislative change to the bill, which he might need for the individual mandate, he might say, I'm going to do it by executive action and by just not enforce the law. That's the moment things get really, all bets are off on what can happen. But I do see the Medicare changes staying in because they reduce costs, and for Republicans to roll those back, they have to add to the deficit, and they're not going to do that. So I'm more just giving you something to watch. How bad it can be, it just depends on whether or not they get this website up and running. And when the president says it's not just a website, the Affordable Care Act is more than that. Right now, it's just a website.
So, just not to, let me just put this out there, just to be, I'm interested in your opinion. In my perspective, the only way to limit the cost is going to be limiting the services that are delivered. It is political suicide for any politician to attempt to do that. And that's what we hear about death panels and all the other the media hype around that. The only legitimate way to minimize access and to limit the benefits that are given is mandated by the federal government as a single payer system. And this is really the mechanism that all the other industrialized countries have utilized to maintain healthcare costs. So in the absence of a single entity running it, we cannot stop the growth, and we cannot really limit access, which is what we need to do in order to control costs.
You said it great. Like, we don't have any cap on those things. Our tax obligations are less than these countries we're talking about. So the question for the American people are, do you want to pay higher taxes to do this, in theory? Because the odds are it's probably going to cost more. If you're going to sustain Medicare as is, we're going to have to raise taxes or we're going to have to cut benefits. That's where we're at right now with Medicare. That's just the fact, the reality.
How do you arrive at cutting benefits, though, that it's political suicide?
No
entity can do that other than the federal government.
The great thing the federal government always does is do tough decisions. We create commissions, right? The commission to study X and make recommendations, we'll vote on those, and it's the commission's fault. So anytime you see a commission, it's just Congress saying, let's have somebody else take a hit.
Well, just to follow,
Two more questions over.
I had a quick follow-on then a question. I mean, in effect, we more or less, the United States more or less subsidizes pharmaceutical costs for the rest of the industrialized world. we have to pay high prices for drugs because drug pharma firms come to us and say, well, we can't charge these prices in any other country. And it just seems applicable to what you were saying. But my question is, Todd, you didn't mention too much about the court battle and the Supreme Court decision that more or less it didn't completely uphold Obamacare, but it has more or less sort of, that decision kind of has upheld it in a large way. Now, with the shutdown and Obamacare being the object of contention there, has the shift in attacking this kind of moved away from the courts and back to Congress decisively, or do you think that these battles will continue to be fought in the courts?
There will be some mild court battles, and there was one that was actually filed this week about the law doesn't say states can run exchanges, but states are running exchanges, or states can't provide subsidies, and then people are trying to catch folks on just missing words here in the bill. The Supreme Court case was very important. It was a challenge to the constitutionality under the Commerce Clause of whether or not the federal government could issue the individual mandate. The idea being the Commerce Clause gives Congress the ability to regulate interstate commerce. It's what we use to pass civil rights laws. It's what we use to regulate basically anything at the federal level. But there's also something called the Reverse Commerce Clause, the Negative Commerce Clause, which is there's got to be some space where the states can regulate it and the federal government can't. So the primary challenge to the Affordable Care Act was you can't tell people they have to enter into commerce so that you can regulate them. That's beyond the scope of the Commerce Clause powers of the federal government, of Congress. Well, the Supreme Court upheld that and said yes, with Justice Roberts going with the more liberal wing of the court, and said yes, it actually is within the scope of the Commerce Clause powers. However, he actually said the opposite. He said it's not within the scope, but it is within the taxing authority. So he upheld the individual mandate under the taxing authority, but not within the Commerce Clause. So the individual mandate lived. But what it also did is it said the federal government could not compel states to engage in the Medicaid expansion. What did that do? Well, for all the states that haven't decided, like Georgia, to expand Medicaid to 33% of poverty, that leaves off millions of people who otherwise were going to get coverage under the Affordable Care Act through Medicaid expansion, subsidized by the federal government. So the federal government was going to pay 100% of those costs in 2014, and 2015, and 2016, and that would go down to 95% in 2017. Okay? The reason states don't want to do it is because they look at those long-term costs and say we can't afford that. Okay? But what has happened is it's created this whole, I think it's about 5 million people who don't qualify for premiums and credits, who were supposed to qualify for Medicaid in states that decided not to do Medicaid expansion. So there's this whole donut hole of folks out there who can't benefit from the Affordable Care Act, who were supposed to be the primary beneficiaries of it. So that is the case. The primary constitutional challenge to the bill is going to stand. The bill kind of survived that.
Yeah.
However, the implications of the court case is, instead of the 50 million you were insured in 2009, I think we're only at 21 million that the bill will do now of the 50 million, as opposed to 35 or so million with the Medicaid expansion. Those numbers are probably a little off. I haven't seen the latest on the insurance coverage. But so for how much money we're paying for this bill, it's not covering nearly. Thank you all for coming today. I really, really appreciate it.